Welcome to the last video of Module 3 of ABEJAS. This last video will give you more information about what diseases or infections affect honeybee adults. These pathogens weaken bees, reduce active foraging, and increase mortality. Before identifying sick bees, first learn about what healthy adult bees look like. Healthy adult bees look fuzzy and have intact wings. Older forager bees look less fuzzy, appear greasy, and have tattered wings. Healthy adult bees move around the colony in a predictable way. Healthy bees can perform wiggle dances to communicate where food provisions are located, but don't twitch in a strange manner. As you learned in the first video in this module, Varroa mites are parasites that feed on the bees' bodies. As they feed, they transmit viruses. The video before this one covered the various brood diseases and what signs honeybee brood may have when infected with certain viruses. There are several viruses that directly impact honeybees' ability to fly and live normal lives. But not all adults or brood will have visible signs if they are infected with certain viruses. One example is the recently identified Lake Cyanide virus. This virus seems to be closely associated with Varroa infestation and nosema infection. Currently, there are no diagnostic signs that bees are infected with this virus other than it's associated with weak or collapsing colonies. Nosemosis, or nosema disease, is caused by a single-celled microsporidian parasite that infects honeybee digestive systems. There are two types of nosema in the United States, Nosema apis and Nosema cerani. Nosema cerani is more common now. Nosema infection begins when a bee ingests spores. When a spore is in the ideal conditions, they will explosively replicate. Replication causes damage to the honeybee digestive system. Nosema takes nutrients from the bees, so the bees consume more food, but they are not satiated. Nosema can be transmitted in a number of ways, such as drinking contaminated water, or when an infected bee feeds from another bee, called trophallaxis. Infection of adult bees can cause difficulty digesting food, producing brood food, and a reduced overall lifespan. When honeybees are infected with nosema, you may observe a declining population, poor honey production, reduced brood production, or K-wing. Honeybee wings are normally held together by little hooks called hyemuli. If a bee is sick, the hooks can become unhooked from the other wing, leading to the wing looking K-shaped. This abnormal angle that the bee's wings rest at is referred to as K-wing. Nosema apis is associated with dysentery, but is not known to cause it. If a bee is sick with dysentery or diarrhea and poops inside the hive, another bee may ingest nosema through fecal matter when cleaning. None of these signs are unique to a nosema infection. Some signs can mean the bees are starving, consuming spoiled food, or infected with viruses. Microscopic or genetic examination of your bees are the only accurate ways to see if they have nosema. The best way to manage nosema is to maintain strong colonies. Manage your colonies well by reducing their stressors, providing proper nutrition, and managing pest infestations. The only registered treatment for nosema in the U.S. is fumagillin, which has the brand name Fumagillin B or Fumadil B. We mentioned a foreign wing virus, DWV for short, in our video about Varroa. This virus can cause adults to have malformed wings that appear crumpled, twisted, or stunted, which impairs flight. Bees with deformed wings have shorter lifespans and only live a few days after emerging. DWV is a significant concern because it can contribute to colony decline. Managing Varroa is crucial to controlling DWV and maintaining colony health. There are a handful of bee paralysis viruses that paralyze adult bees. Acute bee paralysis virus, cashmere virus, and Israeli acute paralysis virus are all associated with Varroa infestations. Signs include weakened immune systems, paralysis, bees unable to fly, crawling, and trembling behaviors before dying outside the hive, shivering wings, body color darkening, and shiny-looking bees due to hair loss. Chronic bee paralysis virus, CBPV, can turn the bodies of adult bees dark and hairless. Bees can have erratic behaviors, including paralysis, crawling, and trembling wings. Dark, shiny bees are the most recognized sign of chronic bee paralysis virus. Colonies with this virus may have many bees crawling outside the hive that are trembling and flightless. This sign may be mistaken for pesticide poisoning. Black queen cell virus primarily impacts queen bees and can lead to their death. Black queen cell virus, as the name says, can only be identified directly in developing queen bees. A queen will die during pupation and turn black. This virus is primarily a concern for queen producers. This virus is thought to be transmitted by nurse bees, feeding queen larvae infected brood food. This module covered information on honeybee parasites, pests, predators, and pathogens that can be detrimental to honeybee colonies. Applying knowledge about honeybee diseases to commercial beekeeping involves diagnosing and managing diseases effectively, implementing preventative measures, using appropriate treatments, monitoring hive health, and continuing education like these videos. It also requires a comprehensive approach that combines practical management strategies with ongoing learning and adaptation to maintain healthy, productive colonies. Remember that the more hands-on experience you gain, the more you will feel familiar and confident handling bees, how to diagnose issues in a honeybee colony such as queen issues, diseases, or malnutrition, and recognizing what management decisions need to take place when issues arise. If you've enjoyed this video, please subscribe to the channel and leave us a comment below to let us know what additional topics you would like us to cover in future videos.